All right, good evening. So for those of you who don't know me, my name is Valerie Phelps, and I am a development manager at the Michigan chapter of the CF Foundation. I'm honored to be here virtually with all of you this evening. Just some quick housekeeping. All questions can go in the Q&A box. And then if anyone would like to use the chat feature, just change it to where it says everyone in the chat box. And that way everyone can see the messages that come through. So while some things have returned to some semblance of normalcy, the past 2 years continue to look a little different for all of us. As always, we're very grateful that we have the privilege to work closely with the Care Center staff at U of M by combining our technology and the center's information to provide you with updates during this time. We are also so happy to announce that Great Strides was finally able to take place in person this year. We've completed 10 out of our 11 chapter walks already, with our final walk coming up in Mount Pleasant on June 4th. I can personally say I've had a blast at all of the walks I've attended this year, getting to see people in the CF community that I haven't seen or spoken to in years. Things may look slightly different on walk day, but our drive for a cure has never changed. Working alongside the CF community, the Cystic Fibrosis Foundation has boundless determination and drives extraordinary results. Thanks to this work, the life expectancy of someone born with CF has doubled in the last 30 years. This has been possible by championing high-quality, specialized care and therapeutic progress. Innovative research led to the discovery of the gene that causes cystic fibrosis back in 1989. Fast forward 30 years, and in 2020, the foundation held 101 meetings, engaged with 48 biotech companies in the US and Europe to progress genetic-based therapies for all living with CF. The CF Foundation has also provided more than 400 grants for CF research and care over the past 6 years, and we're currently working with hundreds of scientists in more than 300 labs across the country. The CFF established a globally recognized care model that includes 120 accredited CF care centers to deliver high-quality specialized care. Since 2014, the foundation has increased funding for CF care by 120%. Today, we continue to evolve our care model to meet the emerging needs of people with CF as they live longer. The CFF has also pioneered the use of venture philanthropy, a research funding model that has spurred the discovery of multiple breakthrough therapies that target the underlying cause of CF. Today, we're investing $225 million a year in CF research and care. This includes our Path to a Cure, an ambitious research initiative that challenges leading researchers and drug developers to accelerate the pace of progress in CF. Currently, there are 40 plus therapies in the drug pipeline with potential to significantly improve the lives of those living with CF. The CFF is championing policies to protect the CF community by advocating for high quality care for all people with CF and their families. This has resulted in historic wins, including protection for pre-existing conditions and mandatory newborn screenings for CF in all 50 states. Compass is a branch of the foundation that supports the CF community at every step of their journey. This is a free service that helps navigate insurance, financial, legal, and other issues. Each year, Compass fields approximately 11,000 calls from different CF community members. The CFF strives to partner with the CF community to continuously learn and engage those living with the disease, resulting in numerous programs to support people living with CF, regardless of where they are on their journey. Thanks to this amazing community, we have increased our community engagement efforts with approximately 1,000 nationwide community-driven programs that enhance quality of life. Our therapeutics development network conducts 60 plus clinical trials annually at 91 research centers, comprising the largest CF clinical trials network anywhere in the world. This network is the hub for advanced lung disease and nonsense and rare mutations. Last year alone, the foundation invested $258 million in research and care. All of this is possible because of all of you. You all are a vital part of our progress and successes. So many amazing things are happening, but we can't stop now. It's vitally important to continue fundraising to further this research and momentum. So I just want to give you a couple updates from our Michigan chapter. So as I mentioned earlier, Great Strides was finally able to take place in person this year. So at this point in the year, Great Strides alone has raised nearly $550,000. And I also wanted to give a big shout out to the Care Center staff who's worked so hard this year and done an incredible job fundraising. After Great Strides season is over this fall or this September, we have a finest event for young professionals, which will be taking place on September 15th at the Eastern in Detroit. And finally, our Evening with the Stars event will also return to in-person this year. That's taking place in the Grand Rapids area at Thousand Oaks Golf Course on Friday, September 23rd. Thanks to all of you so much for allowing me to speak with you guys tonight. On behalf of our entire staff here at the Michigan chapter, thanks to each and every one of you on this call. We couldn't do what we do without all of you. And now I'll pass it back over briefly to Kathy. Thank you.
Hello, I'm Kathy Enox. I'm the Pediatric Program Coordinator at Mott. And I just wanted to say thank you to Valerie and the CFF team who has graciously hosted this and worked with us on many different things. So thank you for doing this again. And then I also wanted to say thanks to all the staff from the Care Center who are attending today to support our colleagues. Now I want to share with you just our agenda very quickly. So Dr. Nasr is going to start us off today with a pediatric program update, and then Dr. Sisson and Dr. Gia will go into the adult program update. Then after that, we're going to hear from some of our dietitians. So Courtney Iwaniki and Stacy Fogarty Brown are going to talk about redefining CF nutrition in the setting of highly effective modulators. Then we have our special guest speaker, Emma Bush, who's an adult living with cystic fibrosis, and her presentation is entitled Embracing Life, and I will leave it at that and let you all hear her story. So we'll start it off with Dr. Nasr.
Okay, good evening, and thank you very much for logging in and being part of this night. We are very excited to present to you our progress in our programs, and we will be I'll start with the pediatric one, and then we'll go to the adult as well. So thank you for the sponsors. We have Chiesi, Viatris, AbbVie, Vivus, Vertex, of course, and Genentech. Thank you, everybody, for supporting us and helping us to conduct this mission. So the first thing I'm going to talk about is our CF clinic. We were always doing our clinic in person before COVID hit. Once COVID hit, I remember March 20th, March 13th was a Friday when the university shut down and we started to do virtual quickly. So we switched everybody to virtual, and then gradually we started to have the patient coming back in. So, which really is important. We needed to take care of seeing the patient, like examining the patient, getting the labs, getting their, spirometries and all of that stuff done, even though we have a home spirometer from the CF Foundation, which was really a good thing for us. So currently the clinics are run as hybrid. Most of the patients are coming in to see the physicians in person. Our dietitians are mainly virtual, but as of June 1st, the two dietitians, Courtney and Stacy, will be coming in at least one day a week. Stacy actually been coming in more than one day a week to try to touch base with patients that she's having a hard time virtual, or they don't like the virtual and wanted to see her in person. And also it's good for the babies to follow up with that. Our social worker both of them, and the pharmacist and the physical therapist are mainly in the clinic as needed. I will leave that up to them. They know the patient, whoever is coming, they have the huddle before the clinic, and they can adjust according to who need to be seen. But they've been a lot of the time on site. The nurses and the respiratory therapists are always on site as well, because we need them to help with the clinic flow and what we need to have done. And I'm not going to go over the home spirometry. I mean, this has been like a journey for us, and the RT owned it and been talking to families about it. And we still wanted people to do the home spirometer to help manage patients in between clinic. Next, I'm going to talk about the quality improvement work we've been doing. We've been doing a lot of work. We are very excited about quality improvement work in general. And actually right now, the quality improvement work, which used to be coming in from me or from Dr. Filbrin, has been coming from everybody. And then actually, so we applied and were accepted to be part of the CF Learning Network, which is very prestigious group to be in. It's only 32 CF centers are part of this collaborative. And Kathy actually is leading a lot of the work in there. She's been really taking a lot of initiatives in with this group. Right now, we are, the CF RISE program, which is preparing the patients to go to the adult side. And sorry, I'm saying a patient, I should say people with CF, to go to, excuse me, to the adult side and to be more independent rather than the parents taking care of everything for them. That program was put on hold during the pandemic, and now we're restarting it. And we actually restarting it in a nice way where our champions, which are the social workers taking care of the administering the program in general, talked with the nurses, and the nurses are part of it right now, and also the dietitians and the physical therapists and respiratory therapists. So the whole team is now reinstating and working on the CF RISE to help with the, reconciling any deficit in information that the people with CF has or their families. So we're very excited about it. And actually Kathy is leading two other centers and our center in having the material of CF RISE in the EPIC program or my chart, so that way it's easier to do. And it's been really making it a lot easier for everybody, and everybody can see it and can work on it. We are still working on ensuring CF Foundation guidelines are implemented. And really the good thing right now is that if a family cannot make it to the clinic because of car trouble, snowstorm, the kid is sick, which I'm hearing a lot of lately, please call our office and make it virtual. I've been, whenever I hear about it, it's like, no, let's make it virtual rather than canceling the appointment. Because if the kids are sick, I need to see them anyway. I don't want to see them in clinic because they cannot come, but at least we can do it virtually. So keep that in mind, that at any time, if a situation comes up and you cannot make it to clinic because of any reason, just call the schedulers and they'll switch it to virtual. We also are keeping track of the yearly labs and the OGTT for 10 and above and X-rays. And then the newborn screen program, our center is the coordinator for the state of Michigan. So we're helping other centers as well with it. And it's been really, we're working on improving the billing for it and improving the follow-up. And again, Kathy is working on that, since she doesn't have enough projects to work on, right, Kathy? So research-wise, so that's for the quality improvement. And if any of you have any ideas that we need to work on quality improvement, please let us know. We always are very excited to work on that. Our research, there are two sides of research. One of them is investigator initiated, meaning we are coming up with the idea and there is a multi-center. This first one is investigator-initiated. That's my project. We realized in a year ago that, or a little over a year ago, that the Trikafta is going to be approved for 6 years, 6 to 11. And we wanted to see if we can find out if how do they get better with it, so other than symptom-wise. So we started quickly because Trikafta was coming in June of last year. So we quickly got patients enrolled. And what we're doing is that before they start Trikafta, we're doing the MRI, or the magnetic resonance imaging. We do also CT at baseline. We do lung clearance index, which was a new equipment for our center. So quickly we learned how to use it. And we do also spirometry. And then we do it 3 months after they start, and then 6 months after they start. And right now, the last patient or last person doing the study will be June 30th. We wanted each center, so we have 2 other centers as part of it. It's our center, Indiana CF Center, and Cleveland. And we wanted to include like each center to recruit like 18 patients, 17, 18 patients. We were able to get these patients quickly in, and they are following. I think we have maybe 1 dropout that couldn't continue, but it's been really a nice study, and we submitted an abstract to the cystic fibrosis meeting in the fall, and we hope to have the results very soon once we finish. The next 3 slides are really the multi-center study, and I'm not going to read all of them. I just wanted to show you that we are really involved a lot in a lot of the studies. Some of the studies are finishing, some are starting. So we've been really very active. Our people with CF in our center have been very much willing to participate in studies, and that's very important because that will help a medication being available to you. So these are the studies we are doing, the range. So we start with little ones and all the way to older patients. And we are doing it in collaboration with the adult side. Dr. Gia has been very important part of our multi-center studies. And there's several coming up that include gene therapy, and that she is leading in, including also the Mayflower study, which is mainly looking at pregnancy and modulator use. So it's a very good collaboration between us and the adult side, which should be, and it's been a long history. Our CF registry, I did not receive the 2021 CF registry data yet. I think it should be coming in the next month or so. So this is from last year's data. So looking first at the pharmacy role, because this is a new thing for our center, and some of you don't understand why are we having a pharmacist, and why are they seen by a pharmacist. So I'm using this slide and 2 others to just make sure that everybody understand the value of our pharmacist, which we're extremely happy that she's part of the team. So when you look at this patient evaluated by pharmacists in 2020, you can see that about 80% of our patients were evaluated by her. Actually, we have 2. We have Hannah Fan, which is the main one, which is about 80% clinical with us. And then there is Ashley as well, that is only 20%. So we are doing much better than the rest of the country, and these are for pediatrics, so which is really good. When you look here, before 2017, really our center is red, and you can see that we weren't really doing much of pharmacy evaluation because we only had 20% of pharmacists. But then as Hannah joined our team right around the pandemic time, or right before the pandemic time, and then now all of a sudden we're doing much better. This is Hannah, and I asked her to put that in and her picture, just in case you haven't seen her, especially with the virtual stuff. And her role is like, CF centers are really, the top centers have been having a pharmacist as part of it. The CF Foundation realized that and actually put in a grant for us to be able to hire a pharmacist, and we got the grant, and that's how she started. But now the grant is over, and she's still part of the team, and we love it. She is partnering with people with CF and families to individualize, optimize CF therapy. She goes over medication, making sure side effects or complications or things like that taken care of. So again, very important part of the team, and it's new addition to us. We're very excited to have her. Looking at the WHO weight for length percentile for babies less than 2 years of age, we are struggling with that. And I know that Courtney and Stacy are very much on it. It's sometimes difficult in the first 2 years of life to get the babies to where they should be. Our weight for length is 58.3% percentile, which is still good. We need them to be above 50th percentile. But other centers are doing better, and they know what that means to me. Like, I'm like on their back to like, okay, we need to get these babies to gain weight. And by being virtual, it's been very helpful because they can touch base with families more often and get them and help them with whatever needed. Also, this patient population is very small in number, so that might affect the results as well. And here you can see that the results goes up and down according to what the babies are doing. The median BMI for 2 to 19 years of age is more stable, and we are doing well on it. And you can see it's a little bit above the national average, but we're maintaining. And you can see that when you look at all these blue lines, all of these are, each one is a center, that we are very close to each other. Very few centers are doing badly, but most of the centers are very close to each other. And you can see here from 2011 to 2020 that we are maintaining above the national average. Looking at FEV1, again, this is very much straight line. And we're about 98%, 98.3%, and seems a bit above the national average, and that is for 6 to 12. 13 to 17, we again, hovering around the median average. So just something to keep in mind. Now, there was a lot of discussion of what did Trikafta specifically do to our admissions? So, and how are the patients doing? So we looked at it by year. So we looked at 2018, we had 168 CF exacerbation admission and 209 total admission, meaning like if you have a G-tube or if you have something else going on. But specifically, the exacerbation was 168. 2019, it was 153, again, very close. Then 2020 came, and all of a sudden we have 71. So we dropped more than half. And that could be for two reasons. One of them is COVID, and everybody was staying home and not really getting exposed to other sick kids. So that was one reason, but also Trikafta is a big factor in that. And that is because in 2021, the same thing, Trikafta was that influencing that, because patients start going out, and we get still 67 admissions. And this is the percent with one or more pulmonary exacerbation, and you can see the trend going down quite a bit. We do call pulmonary exacerbation quite a bit because we, part of our data being in good shape is that because we treat more aggressively, but we're still going down, and nationally is going down. and for 18 and older in the pediatric program, you can see the drop is quite a bit as well, and nationally and in our center. Now, talking about the pediatric highly effective modulator therapy, and you can see that we are increasing the use of it, and now we have 187 patients in 2021 are on modulators. And one of the advantages of having the pharmacist with us is that they actually screen the patients, and in case we miss it or so they always help us to say, these patients qualify, make sure to start the modulators on them. And then they go over it with the family, make sure they understand the value. This slide shows you the modulator by individual ones. So ivacaftor, a lot of our patients are on it compared to national. Then the Orkambi is less, because whoever is on Orkambi, if they qualify for Trikafta, we switch them to it. And then Semdeco, the same thing, but we still are maintaining above national average in both of these. And then the Trikafta has been, a lot of the patients that qualifies are on it. Sometimes patient wanted to wait a little bit, or family, and we usually encourage them to just go ahead and use it, but it's really we work together. The other thing we do is mental health screening, and that has been going well. We have actually the questionnaires for mental health screening are in the pre-visit screen, and it's been going well. And now not only the psychologists doing it, but also the social workers, which are taking charge of that as well. And counseling is referred to. This is my last slide, and I just wanted to let you know about our global work. We've been doing a lot of global work lately. These pictures are from the Egyptian project, but we started our collaboration internationally with Marmara University CF Center in Turkey in 2018. We still are collaborating with them. And the team, quite a bit of the team members went with me there, and they came, visited us. And that resulted in such an improvement in their care. And they started doing quality improvement projects. And they actually are highlighted today in the CF Foundation newsletter. And that's all because of our work with them. They did not know what quality improvement work is before. My next adventure is really working with Egyptian universities. So the lower picture is me talking with them last June with several of the lead people that I'm working with in there. I'm working with 5 universities in Egypt. We were able to get them sweat testing equipment to test patients. And I'm going to be going I have a sabbatical from June to November to be working closely with them. The upper picture is Yusuf, one of my patients that I took care of several years ago. And this is his picture when he was 1 year and 7 months old. And you can see the one to the left, and you can see how malnourished and how horrible really he looked. The one to your right is him at age 8 years of age. He had oxygen on. He ended up dying very soon afterward. He has IV in. He was quite sick, but he wouldn't have done it. He wouldn't have lived to 8 without helping them taking care of him in between. But we wanted to really work hard in getting them better. We are actually taking vests with us that an organization called Best for Life, the Bonnell Foundation connected us with it. So they're sending us 2 vests, and Mrs. Bonnell is taking 2 vests in addition. And if you have any vests that are small or medium child size that your child is not using, we would appreciate, because they have adolescent size vests, but we really need the little ones because most of them are little. So if you do, let us know. That would be very helpful. And then the PFT lab will help me with cleaning it up and getting it ready. with that, this is the median survival. And as you know, median survival now is 50 years of age. And we are very excited about that. And we're hoping to continue to go straight line up. And with that, I will end here. And thank you very much.